Hey everybody, and welcome back to the Get My Body Working YouTube channel. I'm Mus Stewart, a UK-based physiotherapist, and today's video is all about how to assess and treat your shoulder. Shoulder pain can be some of the worst pain you can experience in the human body. I've had two ladies in the past 6 months tell me that their shoulder problem was worse than childbirth, and I believe them. Without a fully functioning shoulder, the rest of the arm is pretty much redundant. Simple day-to-day stuff like washing your hair, putting a coat on, can be really painful, and forget sleeping on it. Thankfully, I've got a great assessment and treatment strategy, which is what this video is all about. It's easy to follow, gets great results, and you can do it to sort that shoulder out. Rehabbing a shoulder, or indeed any other joint, can be hard work and painful at times. We need to change the structures within your shoulder that are at fault and get them working better to reduce that pain. It takes time and effort, but it's definitely worth doing. There are no quick fixes here, and it's unrealistic to think that there are. Now, this video is for people who have a painful shoulder, but it's still intact. In other words, they can move it, but it's not particularly happy about doing certain things. It might be stiff, it might be weak, it might be both, but it's certainly sore. Now, if your shoulder is in fairly severe pain, then this video is probably not the right thing for you at this stage. We definitely need to get that pain under control. I'd always recommend you see your doctor or your GP to talk about appropriate pain medication and get some on board that works well for you. Now, over-the-counter stuff might be good. You might need something that your GP can prescribe for you. You may even need a steroid injection to help settle things down, to give you that window of opportunity to get doing the right things for your shoulder. In other words, doing the stuff that I recommend in this video. Once that pain is under control, then come back to the video and see if it benefits you. Now, if you do have an existing pathology like a fracture or a rotator cuff sprain or tear or something like that, I would always recommend letting that settle down for at least 3 months, having you follow the advice of your medical expert initially. Once you've gone over that initial phase of recovery, then this video is also going to be useful for you. If you're not sure, definitely have a chat with your medical expert and they can advise you whether this would be a good thing or not. Okay guys, let's get into it. So there are two things the shoulder really needs. The first thing is flexibility. It's the most mobile joint in the body. It's a ball and socket joint, and it moves around quite freely, and it can do all these cool things, and it needs loads of flexibility to do those comfortably. If your flexibility reduces even by just a small bit, simple day-to-day things like washing your hair, putting your coat on can be really difficult, and anything to do with a throwing sport can be absolutely painful and can put you on the sideline for months. We've got to get that flexibility sorted out as soon as possible to get that shoulder working properly. Now, I reckon stretches are the best thing to improve and maintain the flexibility of your shoulder. But of course, let's face it, they're a bit boring and they won't improve the strength. Now, that's the second thing shoulders need. They need to be really strong to function properly and be happy with what you're getting them to do. We need lots of strength for all these day-to-day things, and certainly for sports. If you think you've got strong shoulders, that's great. Keep watching. I'll show you a couple of little things that might identify some weaknesses that you didn't know you have, and we'll address those and get your shoulder sorted. Okay, now let's assess your shoulder. Right, now the goal of any assessment is to identify or reproduce your symptoms, whether that's stiffness or pain, or probably both. If we can do that, then we know where to focus our treatments, and then we can work specifically on the problem with a specific solution. That is the key to success. And the first thing we need to do when we assess a shoulder is clear your neck. Now, sometimes shoulder pain can be coming from your neck. If you're not quite sure, stop watching this video now, go and see your medical expert about assessing your neck and work out what's going on. But if you're pretty sure it's coming from your shoulder, let's carry on. Now, is your shoulder intact? Well, we know it's intact by what people tell us. People come in and you watch them move around. You can see a few arm gestures. Maybe they take their coat off and they're moving around. You can tell that their shoulder is intact. But a good little test is the drop test. So I get people to lift their arm up, hold it there, and if they can hold it there for a few seconds, I know it's intact. I might put a bit of pressure through it. They might go, ow, but if they can hold it there, then I know it's intact. Okay, so once we've established the shoulder is intact, let's look at the big one, flexibility. So remember, with any assessment, we're comparing the good side to the bad side. The good side has the answers. So this is why we do this. Okay, range of motion. Now, flexion, abduction, yeah, everybody does those. They're great. But for me, it's all about external rotation and hand behind your back. Why? Because I want to look at the anterior capsule and the posterior capsule of the glenohumeral joint and see what's going on there. That's where the answers lie as far as I'm concerned. So, external rotation, let's do it. So, chuck your elbows in, stand up nice and tall, and then take your arms out to the side like that, okay? And compare good and bad, okay? You might find that the bad one doesn't go at all, the good one goes all the way. It might be painful, it might be sore. I always find that a bit hard, okay? But just comparing the two. Good. Next one, hand behind your back. I'll turn around for this one. So, good arm, bad arm. So good arm might go all the way, okay? Bad arm might just get to there and be a bit stiff and sore, and you might not be too happy about it. Or the bad arm goes all the way up, but it's not particularly happy. It doesn't like going all the way up. Okay, you have a stiff shoulder. All right, let's sort that out now. Now, once we've established that your shoulder is stiff, we need to be a bit more specific about why it's stiff so we can address those later on when we start treating it. Okay, now the first thing I'm going to assess is the sleeper stretch. Okay, now the sleeper stretch is really good at assessing the flexibility of the posterior shoulder capsule and a couple of the rotator cuff muscles. Okay, we're going to assess bad shoulder first, okay? Now, if these structures are tight, you're going to have a sore shoulder, and we've got to sort this out, otherwise we're not going to get anywhere with anything. Okay, so the first thing to do, bad shoulder, we're going to lie down on your side, try to lie down on your shoulder blade to try and block that, okay? Now, your elbow, you can start down here if you like, but try and get it up to about 90 degrees if you can. If that's too sore, have it slightly down like that, and we'll start from there. Okay, but if you're okay, you can have it up as high as you like, okay? Now, I'm going to start here, hand towards the ceiling, all right? Now, very gently, I'm going to take your other hand and gently push your arm down as far as it'll go. I always like to lift my head up a bit, okay? Now, we're looking for two things. Pain. Does it reproduce the pain in your shoulder, or at least pain in the area where you get your shoulder pain? If that's the case, bingo. We're doing this as a treatment, okay? If you're not quite sure, if you get your arm all the way down, then that's great. That's the other thing we're looking for, of course. How far does the arm go down? Okay, if it goes all the way down, great. You need to move that elbow. Let's move the elbow up a bit higher, say 90 degrees now. And let's push it down. Oh, it's a bit tighter. Okay, oh yeah, that's a bit tight. I'm definitely doing this one later. Okay, now again, is that reproducing your symptoms? Yes, good, we're doing this. How far does the arm go down? Make a note of that. So I always say, if it's straight up in the air and doesn't move, that's no turn. A little bit, quarter, halfway, 3/4, and of course, if it gets to the table, that's full. Okay. Now, if you are a bit bendy, take your arm as high as it'll go, okay, and then repeat. Does that reproduce the pain, and how far does it go? Perfect. Okay then, everybody, that's the bad shoulder. So make a note of the pain and how far it went. And let's compare it to the other side, the good side. Okay, so you're going to sit yourself up, Pain's position, pillow around the other side, have yourself a lie down on your shoulder blade there, head on the pillow. Okay, let's start with the elbow sort of down here. How does that feel? That's not too bad. Well, this is going to be tighter. Okay, elbow up a bit higher. Okay, let's say 90 degrees. Okay, here we go. Very, very gently push that down. Oh, that's a bit tight. Okay, see how far it goes and what it feels like. Now, this is your good arm, remember? Okay, now the good arm is the guide. That's what's going to tell us what to do and how good this shoulder needs to get. Okay, so if your good shoulder goes all the way up and all the way down, that's really where we're aiming for. Okay, now if your good shoulder doesn't really move that far, but it moves farther than the other shoulder, bingo, we're still aiming for that. Okay, so this good shoulder is going to tell you how far you need to go or what you need to do, what you're aiming for. Okay, let's have a sit up. Okay, now the sleeper stretch is my favorite shoulder stretch. It's not everybody's favorite because it hurts, but it does the most good as far as I'm concerned. So be gentle with it, be patient, and loosen up that posterior capsule, and you'll find your shoulder is much happier. Now, after the sleeper stretch, we go back to all the normal stretches everybody knows. just as important, we need to see what's going on, comparing the bad and the good side. Okay, horizontal adduction, adduction. So arm across your body, give it a pull. How does that feel? Okay, now it's not just that one. Pull your arm down across your body like that, give that a pull. That's a bit tight, I'm doing that one later. And then back to the middle and then up, underneath your chin. How do they feel? Okay, note those down. Okay, good side. Horizontal adduction, that's much easier. Down, it's much easier. Up, also much easier. Okay, so if that's tighter on the bad side, definitely add that one in. So that's 2 stretches now. Okay, now the next one, triceps, these muscles here, your bingo wings. Okay, they can be tight. They attach to the glenoid and are really important in shoulder function stabilization as well. So here we go. You reach down your neck like that, grab your elbow and pull it down like that. Simple. Pulling down there. That's the bad one. Now, of course, if your shoulder's sore, you might not get there. So make a note of that one to try later on. Good side. Here we go. Reaching down and pull. Is it tighter or do they feel the same? Yes or no? If it's tighter, add it in. Okay, now the next one is for your chest muscles, your pecs. Now, I like to use a doorway for this one, so we're going to go find a doorway. And here we have a doorway. Right, so the doorway stretch. So arms up to sort of high five position here. Let's have your elbows on the door, little step backwards, and you simply lean in like that. Now, how tight does it feel in your chest muscles here? Now, of course, bad side compared to good side. If it is tight, then you're adding that one in. Now, just be careful with this one. Sometimes your shoulder doesn't even like to get to that position, okay? And you find it just reproduces all the pain in your shoulder, okay? So make a note, maybe don't do this one too enthusiastically. Focus on the sleeper and all the other stretches first, but certainly come back to this one because it might be very useful later on. Now, the next question to ask is, how long should you hold your stretches for? And how often should you do them? Excellent questions. If you're going to increase the flexibility of your tissues, the longer the stretch, the better, and the more frequently you do it, also the better. Now, at least a minute, and I would also recommend 2 to 3 minute stretches if you can manage that, all within painful limits. And then, of course, the frequency throughout the day really should be breakfast, lunch, and dinner. Those 3 times will really loosen your structures up relatively quickly. So it can take 24 to 48 hours to notice a big change in your flexibility, and hopefully that corresponds with the pain coming down. Now, that's a big commitment. And I'll confess, stretches are pretty boring, but if you don't have a flexible shoulder, it's not going to get any better. Okay, everybody, the next phase of assessing your shoulder, we're going to look at strength. All right. So flexibility is a big part of a happy shoulder. Strength is also another huge part. Now remember, you need flexibility and strength to have happy joints. Let's look at strength. Okay. Now remember, the goal of any shoulder assessment is to reproduce your pain. So if we haven't got there yet, hopefully we find it in this section. Okay, but if your shoulder has been bothered by some of the stretches, just be a little bit careful when we're doing this bit. I don't want you to aggravate your shoulder too much. Okay, but don't worry, this is all going to be fine. Now, just a quick recap of anatomy. Now, the rotator cuff muscles, we've all heard of those. Google them if you haven't. Now, their job is to keep the socket and the ball of the shoulder joint together. So we need to make sure that they're nice and strong. But we can't forget all the other muscles that are really, really important for shoulder function. And they are your pecs, your trapezius, your deltoid, your rhomboids, and your lats. Now, we've got to remember that all of these muscles, including your rotator cuff, work as a team. There is no point trying to isolate any group over any other group because they all have to work as a team. You've got to train them as a team and they will work as a team. Sure, in some cases, trying to isolate these muscles individually is a good idea, but when it comes to fixing the shoulder and getting the whole thing working, they all have to work as a team. Now, it's really important to get a really strong shoulder for complete shoulder rehab. And I'll tell you why. Because the muscles around the shoulder attach really close to the joint, which means they're already at a mechanical disadvantage to move your arm around. Look at this. If I take my arm out to the side there, just to hold my arm there, these muscles have to work really, really hard just to do that. Now imagine I'm holding something like a kilo weight or something or other. These muscles have to work many times more just to hold that out there. And it soon gets tired and painful because those muscles are getting tired and I need to bring my arm back in here where it's much easier for them to work. So we've got to get those muscles really, really, really strong for a good functioning pain-free shoulder. Okay, everybody, now I'm going to show you how I assess shoulder strength in my clinic. It's a little bit unusual, but don't worry, it's really effective. Now, of course, remember, we're going to compare the bad side to the good side. Good side has all the answers. Okay, now this is a little unusual, but it's very effective. Okay, here we go. So first things first, hands together, elbows, forearms together, right? Elbows down. Okay, keep the elbows together. Take your hands and forearms apart like that and give it a good squeeze. Try and take your hands apart as far as you can, okay? Right, now, how difficult was that? Compare the bad and the good side. If the bad side found it really difficult, let's say it couldn't even move, and you go, oh God, I just can't move it. Okay, we've got a weak shoulder. Brilliant, we've got that great information, we know what to do now, okay? If that wasn't too bad, and you're thinking, okay, let's move on to the next one, right? So, same thing, hands, elbows, but this time, shoulders up to 90 degrees, shall we say, okay? Hands and forearms apart, give it a good squeeze, compare good and bad. How does that go? Is it reproducing your pain? How is the effort? Okay, compare the effort, all right. If the bad side is finding that more difficult, we've got a weak shoulder, bingo, let's get it strong and get you sorted out. Still not sure? Next one. Okay, next one, elbows a bit higher than shoulders if you can. Okay, same thing. All right, how does that go? Don't let those elbows drop down, that's cheating. Keep them high, okay? And again, compare the bad and the good side, okay? Now, hopefully that was a bit hard anyway, all right? But certainly if the bad shoulder found that more difficult and more effort, we need to get that stronger. Okay, now, if you're still not convinced, this is where we need some equipment. So grab yourself a tea towel. I've got myself a little traveling type strap here that I got from the garage. Okay, it's nice and rigid. Okay, if you do have these stretchy elastic bandages, things around here, they're no good for this. You have to get something that's really, really quite rigid. Okay, I don't want any stretch in them. Okay, so double it up a few times. Okay, I can barely move that one. Now this is useful, but I'm going to stick to my strap. Okay, so first thing we need to do here is make it nice and small. Okay, so we're going to start off with the same position. We're playing tug of war with your hands, and you're trying to keep your elbows together. All right, here we go. I'll step back a little bit. Okay, so start with your elbows together. Okay, now it's all about keeping the tension on the strap there. So play tug of war. So give it a good pull. Start with your elbows together, and we're going to reach up as far as you can go. Watch my elbows. They're staying together as long as they can. They have come apart, but they're not going out like that. That's cheating. So try and keep them tucked in as best you can and then go back down. That again. So tension on the strap there, elbows together, reach up as far as you can go. Don't let the elbows go out to the side. That's cheating. Okay. So keep the elbows together as best you can. Okay. And then come back down, elbows together as soon as you can. And away we go. So how many of those can you do? And how does it feel? Whew. All right. Now, careful. It's a lot harder than it looks. Now, if you found any of those strength assessment tests too sore to do, don't worry. Spend a week or two focusing on your flexibility, get that shoulder more comfortable, and then have another go with those exercises. You probably find it makes all the difference. And of course, if you identify yourself as having a weak shoulder, then you need to implement this as well. Now, if you found that assessment exercise a bit tough, don't worry. It was an assessment. It has to be quite tough, but the treatment exercise starts off much nicer. Okay, so we're going to get your strap, make it nice and long. We're going to grab it in a nice wide grip, tuck your elbows in. Okay, so you're pulling on the strap nice and hard, tucking your elbows in, and then you're reaching up to the ceiling as high as you can go, and then coming back down. Keep the tension on there as much as you can. Very good. Keep those elbows tucked in. I like to keep my chin tucked in as well, so I don't overload my neck. Okay. Now, if you find that your elbows are snuck out to the side like that, and you're thinking, well, this is easy, that's cheating. Bring them back in, please, and get going. Elbows tucked in, loads of tension. Okay, and you'll feel all these muscles back here working really hard. Bingo, that's exactly what we want. Now, of course, what's the dosage? What are we aiming for? Now, with any strengthening exercise, you want to fatigue your muscles. That's the first goal. There's no point doing reps and sets because they may be too much or they may not be enough. So your goal is to fatigue your muscles. Okay, now, of course, you may, if your symptoms are a bit irritable, you might find that what you do one day makes your symptoms worse the next day. So you need to try things and find a bit of a balance between being effective and not aggravating your symptoms too much. And sometimes that's just a little bit of trial and error. Okay, now, for those of you who need numbers, I always say try and do 3 sets of 20 before you make it harder. Okay, and it's not just can you get there and you need to be able to do it reasonably comfortably and thinking, okay, I need to make this harder, what do I do? So if you're out here and you're doing the wide grip, tucking those elbows in, let's say you can do 3 sets of 20, so that's 60 reps, okay? How do you make it harder? Well, you simply bring your hands in a couple of hand spaces and then you repeat. So, very good. 3 sets of 20 with that one, thank you very much. And then you work your way in again, 3 sets of 20, okay, good. And then you're eventually getting into the point where you're doing your narrow grip right in here, 3 sets of 20, thank you very much. No cheating, that's cheating. Elbows tucked in, all right. Whew. Now, it might take you 6 whole weeks before you're strong enough to bring your hands in even 1 or 2 spaces, okay? So it's not a fast process, but it's definitely worth it. Now remember, your goal is to fatigue your muscles. So if your shoulders are relatively comfortable, but you do want to get them stronger, you can start with a variety of exercises, wide, middle, narrow grips. That's fine, as long as you're not aggravating your symptoms. I would always suggest try to do this 2 to 3 times a week to start with. See how you get on for a week or 2. If it's all okay, you can increase the frequency and the intensity and build up that strength gradually. Be mindful of your symptoms and make sure you keep stretching. You might find you need to stretch more after a good strengthening session because that'll tire your muscles out, make them tight again. Now, a good thing about that little exercise is it strengthens up your upper trapezius muscles, which can be a source of neck pain. I've known patients come in with a shoulder problem and have that sorted as well as their neck pain. Double whammy, fantastic. So if that helps you, you're welcome. Okay, everyone, I think that's enough for now. That's how I assess flexibility and strength in my shoulder clinics, and I find that really, really helpful for the majority of the patients that I see. A few years ago, I hurt my shoulder in a fall playing tennis of all things. I tore my rotator cuff, and after things settled down, which did take about 6 weeks, I implemented all of these things I've shown you, and look at my shoulder now. This is the good one. Well, they're both pretty good, to be fair. Okay, so look at that. It does work, and I've tried and tested it myself. There is loads of information in this video, so I think it's best to watch it a couple of times. You'll get a little bit more each time, and make sure you write down what you need to work on so you don't miss out on all these excellent things that help. Now, you'll all be happy to hear that I'm going to do another shoulder video soon, and it's all about how to get that shoulder really, really strong, which is super duper important in maintaining a happy, healthy, pain-free shoulder. So stay tuned for that. If you've liked this video, please hit the like button and subscribe to the channel so you don't miss the next shoulder video or indeed any other videos as they get put up. As always, I hope you found this video really helpful and informative. Good luck, and let's get your body working.